Everything on this. I wanted to ask you about the American Health Care Act.
Yeah, sure.
And I understand that it's slated to be voted on in the House on Thursday. And you've got opposition on the far right to this thing. You've got opposition from the Democratic Party. How do you see this playing out over the next couple of days? Do you think there's enough there to get this thing off the ground?
Well, I think what you're seeing is, as people get up to speed on the details of this bill, there are real concerns about throwing 24 million Americans off their health insurance, including 14 million people just next year, not to mention that we're going to whack Medicare. We're going to take deep, deep cuts out of Medicaid, which is a lifeline for anybody with a kid on the autism spectrum or someone with a disability. And we're going to eviscerate Planned Parenthood, which is a good organization that does good work in our community. And nothing in this bill fixes what's actually broken in our healthcare system. So it's the wrong bill chasing the wrong problem. All it really accomplishes is giving a bunch of tax cuts to multimillionaires. So I would like to see a real effort to fix what's wrong with our healthcare system. Unfortunately, this is not it, and I'm very hopeful that will become better known over time. I don't know whether we'll stop this bill in the House. I think it's a very close vote, but I think the prospects in the Senate are tougher, and they should be. We should go back to the drawing board and come up with a piece of legislation that will actually fix the Affordable Care Act. We can mend it without ending it.
So you don't see any chance of, or any hope of, changes to this bill over the next couple of days that may address some of those concerns?
No, they're not going to do anything that could attract a broad base of support. They're going to try to ram it through the House, and the only changes they might make is to make it even less effective in what it should be doing, which is fixing the Affordable Care Act. So I'm not encouraged by what I'm seeing this week, but I do think if we can stop it in the short term, we can have a real conversation about fixing health care, which is what we should be doing.